Singapore, which was seen as a success model in fighting the COVID-19 pandemic, has now reported a record jump in the number of cases. A total of 728 new cases of COVID-19 has been reported by the Singapore Ministry of Health, making it the biggest rise in one single day for the country. Of those who got tested positive for COVID-19 a day ago, 654 of them lived in dormitories, amounting to 90% of the new COVID-19 cases in Singapore. 26 foreign workers living outside these dorm facilities have also tested positive. Westlight, Mandai, the Leo Dormitory, SJ Dormitory, Mandai Lodge, S11 Dormitory are the 5 new clusters linked to the second peak in Singapore. Out of the total 43 purpose-built dorms, 19 are known clusters with more than 2,000 cases, and among the 19 clusters, 12 have been designated as isolation areas where all workers are quarantined for the next 14 days. All of those 10 who died due to the novel coronavirus in Singapore were aged above 60. The pandemic has put senior citizens at a higher risk of coming into contact with the virus than anybody else. Apart from dorms, other clusters could be found at old age homes. Lee Ah Mui Old Age Home, Vanguard Healthcare, Woodlands Care Home and Pacific Healthcare Nursing Home are the 3 clusters with a total of 17 cases and 2 deaths. Singapore will see more cases of COVID-19 in the coming days as the ratio of the infected is likely to increase. Living in tightly packed conditions of these dormitories and thousands of those foreign laborers being exposed to others is of a huge challenge to Singapore. Among those who are newly infected, 10 are from Bangladesh, India and Pakistan. The sudden surge in COVID-19 cases in Singapore has sent the city reeling under pressure. Despite earlier resistance and stringent lockdown measures, the total number of infections in Singapore has crossed 4,400. A total of 10 people have died and 3,734 people are still undergoing treatment. And now we have Mustafa Izzuddin, Senior Lecturer at the National University of Singapore, joining us live from Singapore here on the broadcast. Thank you so much for being with us here on the broadcast. I want to begin by asking you about the second wave of infections that Singapore has witnessed and how effectively the authorities are dealing with it.
Well, they've certainly taken it as a priority. Certainly, we have seen a spike in number of cases. But I think the mechanisms and the processes and all that, the enforcement is all in place. So what they will need to do is to put all their effort to this particular cluster, as you have outlined in your package, and so that we can be contained and then we can then start to battle the pandemic, bring the number of cases down. I think that's the priority of the government. They have taken a carrot and stick approach. What I mean by that is that they have taken both educating the people in Singapore as to the social distancing measures, what should be done, as well as the stick approach, which is enforcement, legislation, even prosecution. So to act as a kind of a deterrent. So all of these things together is what the government is doing, particularly in this new cluster as well as all the other possible clusters. The priority right now is 2 things. One is to prevent any clusters that have been identified from flaring, so further cases. Second is those cases that have been identified, isolate those clusters and then and then deal with the pandemic that way. So I think it's a multifaceted approach that's taken by the Singapore government. It has worked in the first wave. Yes, there is a second wave, but I think the determination and the mechanisms and the process, all of these things are in place. So I think they are doing it with grit, with courage, and with huge determination to try and get this pandemic under control.
Mr. Izzuddin, Singapore did launch a contact tracing app called Trace Together. There are other measures that have been taken by Singapore. It was considered a success story in this pandemic so far and has now become the first country to witness a clear second wave. In that sense, what are the lessons that Singapore has to teach the world in terms of dealing with COVID-19?
I think we are all in this together. So I think all of us have to learn from each other as the lessons that we can learn. of course, I mean, the first wave, we were able to bring the pandemic under control. But we did know there was a second wave coming. I think it wasn't something out of the blue. And we did recognize there could be a spike in cases. So I think it wasn't without, it wasn't a complete surprise. But of course, I think what needs to be done, we still have a model in place. It's going to be very, very important. We do have a model and a framework in place. And that model and framework, we have to stick by it, have faith in that model, and that model will be able to get the pandemic under control. As far as what kind of lessons we can share with the world, I think a couple of lessons. I think number one is that we need to have everyone on deck, all hands on deck. That means the government has to play an important role, which it has, the NGOs, civil society, religious leaders, and the general public, individuals. Each one of us has to play their part, has an important role to play, to be responsible, to combat this pandemic. So I think that is the approach Singapore has taken. There is just not one particular person, one particular entity, but every one of us have to play a part. That's number one. Second, I think you need a combination of approaches. The first is you need a top-down, which is the government provides a leadership, also provides ways to deter people from doing things that could flare up the pandemic. And second, of course, very importantly, it is bottom-up. That means society, individuals in society, I mentioned religious leaders, civil societies, all of them have to play an important role to educate as well as to say, look, obviously this pandemic is going to get worse before it gets better. But we all in this together. It is just a matter of time before we can bring this pandemic under control.
Mr. Izzuddin, India right now is extending its lockdown, 21-day lockdown, by another 19 days. We're in the middle of the second lockdown phase. Singapore had a lockdown. Now it's back to square one. Help us understand in terms of how it is to keep the population under lockdown for an extended period.
It is an extended period of time, but we do allow essential services to still take place. What we have done is we have those public services, ministries, we have not all gone online. We are still continue to provide services. We have not stopped working. We're all working from home. There is a telecommuting that we are doing right now. So all of that I think what this pandemic has shown us is that we need to find alternative ways of working, alternative ways of still running the economy, alternative ways of still providing essential services. So I think what we have done in Singapore is that on the one hand, yes, make sure that everyone is on the same page as far as the measures to control the pandemic is concerned, but also at the same time to allow us to continue to work so that we can continue to make sure the economy is on track, it continues to move, and that essential services continue to be provided. So I think that balance is something that we have been able to strike in Singapore. I think that balance is going to be, again, very, very important as we continue to battle this pandemic.
Right, Mr. Izzuddin, I want to ask you one last question before I let go of you. Help us understand how the situation is on ground in Singapore at this point in time, in terms of, you mentioned the fact that essential services are available. What are the things that are open on the streets of Singapore, and how are people getting by on a day-to-day basis?
Even when you go out for essential services, there is strict enforcement in social distancing. That's number one. Second, you also are preventing big crowds from gathering. I think that has been in place for even in the first wave. So when they go out for essential services, even things like buying groceries and all that, there are social distancing and there are enforcement, there are officers down there to make sure everyone is far apart from each other. There is no the infections, the virus is it's not allowed to infect others. We are able to keep those infections under control. And also, when you go out and buy food, it's all about takeaway and delivery rather than sitting at where you're eating. So all of these things, I think these are all small little things that all of us can do. And I think that has helped us to ensure that the infections is kept under control. The other thing about essential services is that, the hospitals, the police and all that, they all have to be in place. But all of them, I think, we have ensured that they are well taken care of, that they are also not at risk. They are frontline, obviously there is a risk factor, but we want to make sure that every one of us, we play our part so that those who are in the front line are also not in danger of being infected. So I think the essential services will continue. Of course, there is stricter regulations in place, but I think all of these things, it's what we would call short-term pain for long-term gain. I think that's the approach we should take.
Mustafa Izzuddin, Senior Lecturer at the National University of Singapore, joining us live from Singapore with that perspective. Thank you so much for being with us here on WION World is One.